Have you ever been prescribed a medication and wondered why you couldn't take it with certain foods or drinks?
Or maybe you've had to switch medications because of a medical condition or side effect. Well, my friend, that's all because of something called drug contraindications. Basically, it's when a medication should not be taken because it could cause harm to the patient. It's super important for healthcare professionals to know about these contraindications to keep us safe and prevent any potential problems. So, let's dive in and learn more about this important topic.
What is drug contraindication?
Drug contraindications are situations or conditions where a medication should not be taken, as it could cause harm to the patient. These contraindications can be related to the patient's medical history, current health status, or interactions with other medications they are taking. It is essential for healthcare professionals to be aware of these contraindications to prevent adverse reactions and promote safe medication practices.
Medical conditions and its impacts. One of the most common types of drug contraindications is related to medical history. Patients with certain medical conditions may be advised not to take specific medications as they can exacerbate their condition or cause serious side effects. For example, patients with liver or kidney disease may be advised against taking certain pain medications as they can cause further damage to these organs. Similarly, patients with a history of heart disease may be advised against taking certain types of stimulant medications as they can increase the risk of heart attack or stroke. Considerations on health status of patients. Another type of drug contraindication is related to a patient's current health status. For example, pregnant women are often advised to avoid certain medications that could harm the developing fetus. Similarly, patients with a weakened immune system may be advised against taking certain medications that could further compromise their immune system and increase the risk of infection. Understanding drug interactions. Drug interactions are also a common cause of drug contraindications. Some medications can interact with each other, causing serious side effects or reducing the effectiveness of one or both medications. For example, certain antibiotics can interact with birth control pills, reducing their effectiveness and increasing the risk of unintended pregnancy. It is important for healthcare professionals to be aware of these interactions and to advise patients accordingly. Understanding drug interactions too. In addition to the above, drug contraindications can also be related to a patient's age, weight, or other factors. For example, certain medications may not be appropriate for children, as their developing bodies may not be able to handle the medication effectively. Similarly, some medications may be contraindicated in patients with a history of substance abuse, as they can be addictive or trigger cravings for drugs. Preventing drug contraindications. To prevent drug contraindications, it is important for healthcare professionals to take a thorough medical history and to be aware of any current health conditions or medications the patient is taking. They should also be aware of any potential drug interactions and should advise patients accordingly. Patients should also be proactive in informing their healthcare provider of any health conditions or medications they are taking to prevent adverse reactions. Route of administration and dosage matters. Drug contraindications can vary depending on the dosage and administration route of the medication. For example, a medication may be safe to take orally but contraindicated for injection. Drug contraindications can also vary depending on the timing of medication administration. For example, some medications may need to be taken with food or at a certain time of day to avoid interactions with other medications or to minimize side effects. Allergies and food matters. Patients should inform their healthcare provider of any allergies they have to medications or other substances. This can help prevent adverse reactions and identify potential drug contraindications. Some medications can have contraindications with certain foods or beverages. For example, grapefruit juice can interact with certain medications and increase their concentration in the body, leading to potential side effects or toxicity. Possible impacts of medications. Certain medications can also have contraindications with herbal supplements or over-the-counter medications. Patients should inform their healthcare provider of any supplements or medications they are taking to prevent potential interactions. Genetic makeup matters. Drug contraindications can also vary based on a patient's genetic makeup. Pharmacogenetic testing can help identify potential drug interactions and contraindications based on an individual's genetic profile. Patients should also be aware of the potential risks and benefits of medications and should discuss any concerns with their healthcare provider. This can help prevent potential adverse reactions and ensure that the patient receives the most appropriate treatment for their condition. Summary. In conclusion, drug contraindications are an important aspect of medication safety. Patients and healthcare professionals should be aware of the potential risks and should take steps to prevent adverse reactions. By being proactive and informed, patients can ensure that they receive the most appropriate medications for their condition while minimizing the risk of harm.